I genuinely think it's about people feeling more welcome. So maybe we have to have clinics in pop-up places where there are more Black people. Maybe it needs to be a bit more personal, and maybe that will make it a bit more easier for people to access it.
With services, especially when you go into either a hospital setting or a clinical setting, as a young person, it feels very cold and it feels like it's not really a safe space for you. So it's kind of like, how could we break the barrier of even first approaching and sitting in there? That makes sense. So it could be someone just coming out of behind the desk and saying, is everything okay? Do you want any water? Do you want a cup of tea? Just to make that person feel a bit more welcomed.
To have people who understand the culture and what it is to be an African or a Caribbean person, a person of color, a person of an Asian background. There is a difference between each one of them, and how we speak, how we dress, how loud we are doesn't mean that we're aggressive. So I think cultural training for staff, for doctors, for nurses around that, and also training the community, bridging the gap to show that you can go to a clinic and this is the procedure that will happen and your life's not going to be over. This is what it might look like. And knowing what you're allowed, a bit like know your rights for when you get stopped by the police. It's the same for sexual health. But as it stands, there is a distance, there is a gap where people just think they don't care about us anyway.
I think that a lot of how Black women are treated when they're accessing sexual health services is related to sort of perceptions or sort of stereotypes and stigma that exists towards Black women in regards to sexual health. So I think that sort of these attitudes need to be challenged.
Sometimes it can be unfair to just expect doctors, middle-class doctors and middle-class nurses just to understand. Why would they? It's okay to come out of your comfort zone from your offices and from your clinics and come into our communities. Have a space where it's just not in a big clinical base. It could be more community where you can develop relationships, because until you develop relationships within the community, who have been broken through with lots of lack of trust. One thing I've learned about the clinical side of things, they never understand what the community is about. They just expect, we'll be provided for free, they should come in. It doesn't work like that.